Hello and welcome to week number 10. We're moving along in the course and we're almost there. This week we specifically discuss privacy and confidentiality, which is a key characteristic of a free and democratic society. So confidentiality and privacy are very important to an ethical practice. One of the ways that we build trust and minimize harm is by keeping information private and confidential. Hence, it becomes value number 5 for the CNA Code of Ethics. As has become our routine, we have a bunch of goals and objectives to work through for this week. We'll be examining the concept of personal information, how we appropriately disclose, what does privacy and confidentiality mean to us as nurses, and how does that influence our ethical practice. We'll connect privacy to ethics, freedom, and a just society, and we'll specifically explore strategies that nurses can use to preserve an individual's privacy and confidentiality, especially in this electronic age. We'll explore some of the laws, in particular PHIPAA, and we'll discuss the readings, and we'll complete the forum activities for the week, and that will conclude week 10. So in terms of understanding some of the language, I just want to make some distinctions that privacy is about people. A patient has the right to privacy and to disclose only those details about his or her life, illness, feelings, finances, and family that they choose to disclose or to not disclose at all. Confidentiality is about our duty to protect the information that we have. It's really what the nurse does with this information. So privacy is about people, and confidentiality is about the duty to protect the information. Patients expect that the things that they tell us are private and that they will be guarded. So it's important to recognize in this notion of privacy that people have autonomy. Here again, people can disclose or not disclose, and people should not in any way be forced or coerced into telling us things about their personal life. On both this slide and the next slide, you will see that this idea of maintaining privacy and confidentiality is a very old idea. We see here in the Hippocratic Oath, I will keep secret and I will never reveal. Or from Florence Nightingale, will hold in confidence all personal matters. The textbook talks about confidentiality is the ethical principle that requires non-disclosure of private or secret information with which one is entrusted. We see the connection to the Hippocratic Oath and to Florence Nightingale's pledge. Confidentiality and privacy are also part of the CNA Code of Ethics, part of the College of Nurses Standards of Practice, part of the ICN, and they're enshrined in law. This is very important to Canadians, that we have strategies and that we have laws and that we have protective mechanisms to ensure our privacy and confidentiality. So as I mentioned, there are laws that protect privacy, and so we have entitlements as Canadians to privacy, and these are enshrined in Canadian law. And as nurses, we have the responsibility to advocate for others, and to speak up for others, and to speak out against breaches of confidentiality or trust. Despite the notions of privacy and confidentiality being important and enshrined in all of these institutions and laws, breaches of confidentiality are sadly not rare. Many of us see maintaining confidentiality as common sense, so when we ask people about it, I think there's not a nurse in our classroom, and there's probably not a nurse in Canada who would not know that maintaining privacy and confidentiality is important. And yet something happens in being human that causes these breaches. So as I just mentioned, sadly, breaches are not uncommon. And this is probably because as healthcare workers, we routinely hear intimate and private details of people's lives. And we sometimes, in being human, find it difficult to resist using this information for our own gain. But if we go back to the ethical principles laid out by Kant, we can see that we can never treat people as a means to an end, rather as an end in and of themselves. Patients trust and rely on us that we will protect the information that they provide to us, and we know that health information is amongst some of the most privately considered information. It is in fact, when you look at research studies, people view the information about their health as the most important to keep private, next their financial information. So breaching confidentiality is a sure way to lose the trust and to infringe on someone's dignity. So when we decrease trust, we cause harm, and this is through this mechanism that privacy and confidentiality becomes an ethical issue. Or rather, I should say it's through one of the mechanisms that privacy and confidentiality becomes an ethical issue. So a few slides ago, I made the comment that patients have the right to disclose or not to disclose, to tell us the level of detail or no detail at all. And this connects up to the philosophical positions on privacy and confidentiality in terms of autonomy and respect. People get to decide what happens to their body, and they get to decide what happens to their information. And I guess it's this trust that patients have in us that when they tell us information, that it will remain private and confidential. The utilitarian view gives us a little bit of insight into the notion that not all information is kept private or confidential. And so you probably can think of instances where, as nurses, we are obligated to break confidentiality and to reveal information that patients may have told us in private. So, for example, child abuse or suicide. It's the utilitarian philosophical position that helps us to think about the limits to privacy and confidentiality. And John Stuart Mill, as you know, the end justifies the means. And so it's Mill's work that suggests to us that personal freedoms may be constrained when the exercise of this freedom puts others at risk. So, for example, we have laws around STD reporting. And so while the person with the STI may not want that information disclosed, for the sense of the freedom of others and the personal well-being of others, that information is disclosed. So it's really about paying attention to the long-term consequences of both knowing and not knowing. We have an obligation not to harm others, and there are times where as healthcare workers we have information that needs to be used to prevent harm to others. And it's really the degree of harm that is the debating point. So we can ask, for example, are people harmed by not knowing that their loved one is sick? So if you feel you're looking after a patient, for example, and you feel very strongly that their family should be called, and yet the patient is saying, no, I don't want them called, the degree of harm is weighed. And in that instance, we would not call the family because the degree of harm is not considered sufficient to the family not knowing that their family member is sick. So as I just mentioned, there are exceptions to confidentiality, and really some of this we know because it's enshrined in law, and that we have laws that tell us when we need to disclose, and there are other instances that are a little bit grayer, and so it's really about deciding when and if to disclose personal information, and it's the degree of harm, as I just said. We would never disclose outside of the rules and the laws that we have without having discussions with colleagues and our manager. And so we make decisions as a team in terms of breaking confidentiality. It is almost exceptionless that a nurse would make this decision on his or her own. So we do this as a team, and we think about ideas to help us guide through this decision of whether we would break confidentiality. Is that, can the healthcare provider do his or her job without this information? We have discussions about the greatest good. So, for example, we put signs above a patient's bed suggesting that they're at risk for fall, or that people are under some kind of infection control practice. So this is the greatest good discussion. So there's a lot of ethical and professional judgment to these. And so before those signs were posted, many discussions were had. I was a nurse at the time working at the bedside, and we had discussions about the greatest good. And it was decided that people have the right to know, and that people entering the room have the potential for harm if they don't have this information. So if ever you're unsure about disclosing, my first line of advice to you would be to contact agency policies or your privacy officer or your manager or your colleagues. And that really, until great consideration has been made or the situation is an emergent one, you would not break confidentiality. So here is a list of instances where nurses must disclose private information. So instances of child abuse, elder abuse, unsafe practices by others, we spoke about that a few weeks ago, suicide. So if somebody is about to harm themselves or others, we need to notify. Sexually transmitted infections, as I mentioned, intention to commit murder or harm others. And if somebody is a formable mental health concern, so they meet the criteria to be formed. There may be others, and perhaps you can think about these when we discuss in the forum. So in terms of our fidelity and notions of relational ethics, we know that the trust that we have with our patients comes from this notion that they trust us to keep their information private, to preserve their dignity, and to maintain confidences. And this leads us to be quite loyal to our vows and our promises, because without this, we risk breaking that trust and causing harm. So we need to be very careful about what we promise to our patients. And when patients are disclosing information, we need to sometimes alert them to the fact that we do need to tell others about this. So please join in the discussion forum, and we'll continue talking about privacy and confidentiality and what nurses can do to enact this value statement. I just wanted to draw to your attention as you're writing your essays that there's a good template for discussions about the work setting and the context on page 440 of Ray. It's just a little aside, a little bonus.